Today, I'm going to show you how to lower your blood pressure naturally. No medications. No expensive supplements, just real evidence-based strategies. High blood pressure affects over 1 billion people around the world, and the most dangerous part is that most people don't even know they have it. That's why it's often called the silent killer. I'm Dr. Aria Wells, and in this video, I'll walk you through 10 doctor-recommended lifestyle changes that are clinically proven to reduce blood pressure. Whether you've just been diagnosed with hypertension or you're looking to prevent it altogether, these tips can have a life-changing impact, and everything I share is backed by science. To fix something, you need to understand it first. Blood pressure is the force your blood exerts on artery walls as it circulates through your body. When your heart contracts, your blood pressure rises. That's your systolic pressure. When it relaxes between beats, it drops. That's your diastolic pressure. Chronic high pressure can silently damage your arteries, heart, kidneys, and brain over time, leading to heart attacks and strokes. Let's begin with diet, and one specific eating plan has consistently proven results: the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. It's essentially a clean, balanced way of eating that emphasizes fruits, vegetables, whole grains, lean protein, and low-fat dairy. Following the DASH diet can lower systolic pressure by 5 to 6 points, a significant reduction by any standard. A major factor in the DASH diet's success is sodium reduction. Excess salt in your diet stiffens your arteries and increases your blood pressure. But here's something most people don't realize: about 80% of our daily sodium intake doesn't come from the salt shaker. It comes from processed foods and restaurant meals. That's why it's so important to read labels and stay under the recommended limit of 2,000 milligrams of sodium per day. To understand how impactful sodium reduction can be, look at Finland. A few decades ago, they introduced warning labels on salty foods and promoted lower sodium options. Even fast food chains like McDonald's had to get involved. Over time, average sodium intake dropped by 30%, systolic blood pressure decreased by 10 points, and heart attack and stroke deaths declined by 80%. Life expectancy rose by several years. It's a powerful reminder of how much impact diet can have. But sodium isn't the only mineral that matters. Potassium plays a huge role too. Think of potassium as the antidote to sodium. While sodium stiffens blood vessels, potassium relaxes them. It also helps your kidneys flush out excess sodium. You'll find potassium in foods like bananas, oranges, sweet potatoes, spinach, and beans. Increasing potassium-rich foods can lower blood pressure by 5 to 7 points. However, if you have kidney disease or take medications that retain potassium, talk to your doctor first. Let's move on to physical activity. You've probably heard that cardio is good for heart health, and it is. But a 2023 study published in the BMJ analyzed over 270 trials and found that isometric exercises like wall sits and planks were even more effective for reducing blood pressure. Some people saw drops of up to 8 points. The good news? All types of exercise help: cardio, strength training, yoga. Just find something you enjoy and stick with it. Now let's talk about weight loss. You don't have to lose a ton of weight to see results. In fact, for every 1 kilogram or 2.2 pounds you lose, your blood pressure drops by about 1 point. So even a modest weight loss can significantly benefit your heart and arteries. Alcohol is a bit tricky. Many people think a drink or two helps them relax, and that's not entirely wrong, but over time, especially if you drink more than 2 drinks a day, alcohol raises blood pressure. Cutting back or stopping altogether can make a noticeable difference in just a few weeks. Smoking is another huge contributor. Nicotine causes blood pressure to spike instantly, and long-term smoking stiffens the lining of your arteries. Quitting smoking isn't easy, but it's one of the most impactful things you can do to improve your heart health and blood pressure. Sleep is another essential part of the equation. Studies have shown that people who sleep less than 6 hours per night are significantly more likely to develop high blood pressure. If you're having trouble falling asleep or staying asleep, look into sleep hygiene techniques. But also watch for signs of sleep apnea, a condition where your breathing stops and starts at night. Loud snoring, choking, or gasping during sleep can all be signs. Sleep apnea is a major cause of resistant hypertension and needs medical attention. What about stress? The long-term impact is less about the stress itself and more about how we respond to it. Do we eat more junk food, smoke, drink more alcohol? That's where the real danger lies. Finding healthy ways to cope, like mindfulness, breathing exercises, or even pet ownership, can help. In fact, studies show that pet owners, especially Dog owners tend to have lower blood pressure. One small study even found that adopting a dog had more impact than a common blood pressure medication. Now, let's say you follow all these strategies and your blood pressure starts to drop. What should your goal be? According to the SPRINT trial, aiming for a target of 120 systolic instead of 140 led to a 25% reduction in heart attacks and strokes and a 27% lower risk of death. However, more aggressive treatment comes with risks like dizziness or kidney problems. So always work with your doctor to find the right target for you. I know this might seem like a lot, but you don't have to change everything at once. Start small. Pick one change from this video, just one, and commit to doing it consistently. Leave a comment below and let me know which one you're starting with. It's a simple way to hold yourself accountable and inspire others. And finally, even if you do everything right, sometimes lifestyle changes aren't enough, and that's okay. Medications can be life-saving and are nothing to be ashamed of. But if you've learned something valuable today, please share this video with someone who might benefit. High blood pressure affects half of all adults, and together, we can make a real difference. As always, stay curious, stay healthy, and I'll see you in the next one. Bye for now.